Hi, and welcome to Did You Know? Did you know that 1 in 10 Canadians has kidney disease? Because there are often no symptoms until kidney disease is quite advanced, many people aren't aware that they have the disease until they've lost most of their kidney function. So that's why it's so important to know the risk factors for kidney disease and to talk to your doctor about your kidney function. Some people are at higher risk of kidney disease and should have their kidney function tested by their physician or healthcare provider, even if they feel well. So please take a few minutes to answer these 10 questions. The answers will help you know if you should talk to your doctor about having your kidney function checked. Are you ready? Let's start.
Question 1. Do you have diabetes? Have you been told you have prediabetes, borderline diabetes, or gestational diabetes?
Diabetes is the leading cause of kidney failure in Canada, and uncontrolled blood sugar levels can damage the delicate filtering system of your kidneys.
Question 2. Do you have high blood pressure?
High blood pressure gradually damages the tiny blood vessels in the kidneys. High blood pressure, called hypertension, is the second leading cause of kidney failure in Canada.
Question 3. Do you currently smoke?
Smoking is one of the most important risk factors for kidney disease. Smoking damages the kidneys by hardening the arteries and narrowing the blood vessels, which can restrict blood flow to the kidneys and cause them not to work as well.
Question 4. Are you of Indigenous, African Caribbean, Asian, South Asian, Hispanic, or Pacific Island descent?
People of these descents are at higher risk for developing kidney failure. Indigenous people in Canada are in fact 3 times more likely to have their kidneys fail as non-Indigenous people. And there are many reasons for higher rates of kidney failure in certain populations. Diabetes, genetics, and a change from traditional lifestyles can be factors. Access to healthcare services and other personal, social, or financial issues can also play a part in higher rates. So if you're a member of one of these populations, talk to your doctor about having your kidney function checked.
Question 5. Do you have heart problems? Have you ever had a heart attack or stroke? Have you been diagnosed with cardiovascular disease?
Heart disease and kidney disease are closely linked. When the heart is not pumping well, it doesn't move the blood to the rest of the body very well. So the kidneys don't get the proper blood flow, and this affects how well they're able to function.
Question number 6. Do you have a family history of kidney failure?
Kidney disease may run in families because some forms of it are inherited. Even if only one person in the family has kidney failure, all blood relatives should be tested. Family history is also a factor in the development of both diabetes and high blood pressure, the major causes of kidney disease.
Question 7. Do you take anti-inflammatory pain medication like ibuprofen, naproxen, Advil, Aleve, Motrin, or Celebrex?
These medications are called non-steroidal anti-inflammatory drugs, and they've been associated with acute kidney injury in the general population and with progression of kidney disease in those with chronic kidney disease. Heavy or long-term use of these medications can cause chronic kidney disease.
Question number 8. Are you at an unhealthy weight?
If you aren't sure, you can check your body mass index or your BMI on the Dietitians Canada website. Your BMI is one of the many factors that you and your healthcare provider can use to check your health. The BMI measures risks based on your height and weight. It may not be accurate in people who are muscular athletes, under 18, those with amputations, pregnant or lactating women, and adults over 65 years of age. If you have obesity, you have a greater chance of developing diabetes or high blood pressure, which are the leading causes of kidney failure. In people with obesity, the kidneys have to work harder by filtering more blood than normal. So this extra work can damage the kidneys and raise the risk of developing CKD in the long term.
Question 9. Have you had any issues involving the urinary system and or prostate gland? For example, multiple kidney stones, cancer of the prostate gland, kidney cancer, or recurring urinary tract infections.
Issues of the urinary system and or prostate gland can sometimes contribute to kidney problems.
And question number 10. Are you 65 years of age or older?
CKD can occur at any age, but it becomes more common with increasing age. The high prevalence of CKD in elderly may reflect the increased presence of a variety of different risk factors for CKD, such as diabetes and high blood pressure in this age group. Regardless of the reason, the high prevalence of CKD in the elderly population is important because CKD increases the risk of heart attacks and strokes. So ultimately, you can't change your age, but once detected, simple treatments can slow down the decline in kidney function, prevent complications, and improve the quality of life. Are you interested in learning more about the risk factors of kidney disease? If so, go to areyouatrisk.ca. And now you know.